Welcome to Speak as One. I'm Julie Corria. Today we have Dr. Drew Pinsky, also known as Dr. Drew, who is an American media personality, an internist, and an addiction specialist. He has hosted radio and TV shows from Loveline, Celebrity Rehab, Teen Mom, and more. He currently hosts many podcasts, the Dr. Drew podcast, Live with Dr. Drew and more. Author, activist. Hello, Dr. Drew.
How are you? Nice to see you, Julie.
I'm great. How are you?
I'm good. As you know, I was fumbling around in the studio. I'm here by myself right now, attempting to get on the air with you on my own, and I should never be allowed to do that. It's been, I've fumbled multiple times, but I'm glad to be here with you. Finally, we made it.
We finally made it. We did. Well, I have to say, I from some professions that I've been in before, I've had the opportunity to meet people who are more in the public eye, but it's just not my style to usually go up to them and approach people. When I saw you during South by, I had to take myself out of the equation, and I thought, this is for mental health and what I'm doing. And so you're the first person I've ever really approached like that, and you were so gracious and kind.
Well, you were very clear and great, and it's right up my alley, so hopefully we can talk about things that will help.
Yeah, absolutely. Well, speaking of like gracious and kind, I told so many people that I would be talking to you today, and the consensus was that you have always just been so compassionate, and you seem to genuinely care about everything that you do. And
I do. I'm to a fault, frankly. I'm however you construct these ideas, I'm what you call codependent, and as a result, it's like everything in human beings, it's both an asset and a liability. So it's great when I have to focus in on someone, and I always do care. It's problematic if you have back particularly early in my career when I had manipulative, problematic patients that I didn't understand what they were doing to me. But a lot of my own therapy, and then learned about these things very, very quickly, and a bit better at it these days.
Yeah, well, you have done so much over your career, and I'm just curious, when you got started and all that, does that compassion come from your own journey of, understanding mental health, and would you mind speaking on that a little bit? Yeah,
sure. So much of whatever our particular proclivities are have no doubt resiliency and genetic factors. So I was endowed with something that made me go that direction. I myself had a bunch of a good burden of trauma and abuse, and not horrible, not over the top, but enough to injure me. Mm-hmm. And then so as I grew up, I didn't really understand what was going on, but by the time I hit college, I started having depression and panic attacks. I was mistreated terribly. I'll just tell you a brief story. I started having these panic attacks, and I was sufficiently tuned into medical phenomena to understand that there was something emotionally wrong, although my first move was to go to the physician, go right to the sort of medical unit down there at the college. And back in those days, this is the 1970s, these are manned by family practitioners who were in the twilight of their career, just sort of donating their time. There was no adolescent health care, and that became very clear to me very quickly when the first thing that one of the doctors did was look at me and go, "You just need to get your act together. Just take long walks in the woods." And I was like, I would if I did. I tried. Are you kidding? I would do anything to feel better than I feel right now. Right. Then went up into their mental health services. Again, I had sufficient understanding to at least go there. And the comedy on that is it was literally in the mental health services and the medical services were separated by a quarter mile, and the mental health services were literally in the bell tower. They're literally bats in the belfry, literally in the bell tower. And I had, a series of sort of bad care and sort of struggled through. But a lot of what was going on with me at the time was I really had not formed a stable identity yet. I didn't know what to do with my life, and I was overwhelmed and anxious and depressed, and relationships were a mess, and all the usual stuff. Got it together, found a cohesive sense of myself, and but still had a lot of anxiety, not so much panic anymore, but lots of anxiety. And it was actually my wife. We had triplets, and so my anxiety was quite appropriate to the moment.
Right.
But even so, we had a 1-year-old at one point that needed a brain surgery, and I was working 14 hours a day, and I guess my anxiety went off the chain. I wasn't even aware of it. And my wife called me one day and she said, "You need to see a therapist." And I was like, "Yeah, I really want to do that. It's important for the work I'm doing." I was working in a psychiatric hospital at the time, and I thought, "You're right." And I'm planning to do that. And she just said, "No, call somebody now." And literally the hair stood up in the back of my neck.
Yeah.
I thought,
Wow.
okay, she's telling me something. I hear her. Put the phone down, called someone, and went into really deep emotionally focused therapy. And it was one of the best things I ever did, and made me a much better clinician, much better, particularly in the realm I ended up in. Thank goodness I wasn't doing a lot of that kind of work before I cleaned my own palate up. But I can talk about that if you want. But however you tell me where to go next.
No,
That's my tale of woe.
No, thank you for sharing that, because I know personally that panic attacks can just overtake
They're
almost
good times, right? Good
Yeah.
times.
Yeah.
And I had depersonalization, dissociation, everything you could have with panic. I had it. Although, again, because I came from a medical family, I knew I wasn't dying. I just figured I was going crazy or I had a brain tumor. I figured it was all neurological. But I knew in the back of my mind, this is no. This is something psychiatric.
So what are the tools that they gave you, and do you still have anxiety?
Yeah. So one of my areas of great interest is interpersonal neurobiology. In fact, funny, my son just found this series of cassette tapes from somewhere in the early 90s. It was the mid 90s. That was it from a conference. I didn't even attend. I just heard about it. And thank God I sent away for these tapes, which was where the greats of interpersonal neurobiology got together and really started forming a cohesive discipline. So it was Alan Shore and Dan Stern and Bowlby and Mary Main and all these. I mean, the greats of this field got together for one conference, and I was lucky enough to grab those tapes and listen to them. I felt like I was listening to the disciples. But it fueled my interest, and of course the field has evolved since then. We have now Besser van der Kolk's idea and Stephen Porges, and we had worked out this neurobiology unbelievably. And it was, I think, one of the reasons I was so fascinated by it, because I was in deep emotionally focused therapy, because I didn't get enough of that interpersonal neurobiological exchange, which many trauma survivors don't, which is necessary to build a good connection with primary affect and to regulate it. And so my anxiety was largely the result of it's a weak connection between primary emotional states, their second order representation, and their regulation. And so through being in the presence of a therapist, I had a therapist with outstanding boundaries, so I don't really know what she was doing. I just can know what I observed. And she was essentially rebuilding and sort of getting back to and reworking attachment is just sort of general ideas of what was going on, and then building the rapprochement phase of going out into the world and then refueling in that with that attached object, which I didn't get any of that. I missed all that development when I was a kid.
Yeah, no, I understand 100%. Just like what you're talking about, in the sense that I feel like trauma is affecting, you hear about it so much more lately. And the reason I can relate to what you're saying is that I actually ended up having to go to a trauma treatment facility for 30 days.
Yeah, I would have. I think my
And
treatment would have been moved along more quickly had there been available, which there was not, so much of the good trauma therapies that we have now.
yeah,
So it took me a
really
long time to work it through, but that could have been hastened. Today it wouldn't take so long.
Right. Yeah. And, but are people, do you think, identifying now, like, do you understand, since you know so much about trauma, and thank you for sharing that, what do you see now out of trauma? Because we have been through so much as a society, but I really have to believe that it was always there.
Yes. Well, I don't know that it has always been there, but it has certainly been there in the recent past, right? Mm-hmm. So I hope I pack everything in I want to say here, which is we have been through a pandemic of childhood trauma. I saw it when I used to do Loveline in the 90s and early 2000s. All I was hearing about was trauma. Every
Yeah.
call, every disturbed relationship, it's all we heard about. And it came on during the 80s. It wasn't there prior to the 80s, and it came on all of a sudden. And I started looking at the 70s and realized that we unleashed terrible behavior on kids and sort of co-signed as, hey, whatever you're into, man, these are little adults. What's the big deal? Horrible, horrible, horrible. And then, of course, it has intergenerational repercussions once we unleash all that. So there it was. I wrote a book in about 2010, 12, something like that, about narcissism. And I then wanted to write a chapter about this fact and the fact that this wasn't normal. That there's only been a few sort of historical examples where things have been as pervasive, child abuse, particularly childhood sexual abuse, as we had just went through. Mm-hmm. And I wanted to write about pre-revolutionary France because I felt like guillotines were coming. That scapegoating and sort of scapegoating mob action was inevitable for us, and it came. I didn't know about Twitter. I didn't know about social media. That hadn't been invented yet, but that was the vehicle for the cancellation, the acting out, the mob scapegoating, and it came. And thankfully it didn't get as crazy as it could have, because I'm hoping that people are taking a good look at themselves and learning to regulate. Mm-hmm. The pre-existing trauma was there, and then we traumatized everybody. It's sort of the Trump era traumatized people in certain ways, and then the COVID traumatized people. And then we sacrificed 8 to 15-year-olds. I don't know what, I just think that's one of the most horrific displays of disregard for half a generation. It's just unbelievable to me what we did. But so we did it, and now it's time to rebuild and to deal with it. And you're starting to hear people talk about anxiety, depression. But a lot of that is going to be PTSD and trauma.
Yeah, and I mean, what do you think is going to happen? I mean, we don't have any education in the schools. I mean, there are people talking about it now on social media, but it's such a, for kids to get on social media, then that is, I mean, my own
it's scary.
It's
right?
scary.
That's scary. Yep,
so
absolutely.
Where do we go with this?
Well, when you say their education, do you mean psychoeducation, or there's no education period? Because
There's
both are true.
No education period. I mean,
yeah.
Honestly,
The greatest sort of headline or billboard to that fact in this country, to me, at least in certain states, was watching these Ukrainian moms who the men were left behind. The moms were going across the border into Poland with the kids. And it's true, and the people would put microphones in their faces, the news, the journalists, and every single mom would say, terrible, this is awful. But these kids have been out of school for 2 weeks. We have to get them back in school. It's been 2 weeks. They need school. And I thought, we're 2 years in, and we're still keeping kids out of school. Of course it's right that they should be back in 2 weeks. They put kids they were so right about that, they put kids into Polish-speaking schools just so they got the structure and socialization that is so critical to those age groups. And of course, we just blew it all out. In the name of what? That's what my question constantly is. I don't know what we were doing. But that's very, very, very concerning to me. So we're going to have a bunch of young adults with a lot of anxiety and panic and depression and things. Fortunately, I don't believe they were as exposed to as prevalent an incidence of childhood trauma as we had been going through the previous 30 years. I feel like that has been sort of getting better. Though certainly plenty of ruptured families, plenty of physical abuse, plenty of divorce. And only now can you say that divorce is an adverse childhood experience. You literally politically, that was something that would get you canceled. And we now know, I saw some data last week that suggested the impact on children of divorce is very much similar to physical abuse in terms of the long-standing, profound effects on their mental health.
Oh, are you serious? I didn't know that. So I'm divorced. It has been 6 years now. The kids were very little when we got a divorce. I've been just because of the field I'm in, and I've tried to really, nurture this in the best way I know how. And my ex-husband as well. We have a great co-parenting relationship. But, I do think of that, even though it seems like we're all in a great place and my kids seem like they're in a great place, I do think of that. And I had no idea that it was, considered somewhat similar as an adverse childhood home. So I'll have to look more into that.
Well, but you're on top of stuff, and it's impossible to be a perfect parent.
Sure.
Let's take that heat off everybody. But to pretend, what I don't like is just going, "Hey, kids are resilient. Look, they're doing fine." Yeah, all kids do fine. You pull them out of a bomb shelter, they go play soccer, they go mess around. That's what kids do. It leaves things that we have to attend to. That's all. It's that simple. I mean, look, it took me till I was 30 to start to attend to that stuff. Don't wait. Just attend to it.
Right.
We thankfully have armies of people now that are very, very good at this. Let's take advantage of it. Now we have Zoom meetings. That one of the great things that COVID brought us was, this sort of telemedicine, telehealth, Zoom mutual aid societies. It's been good. That has been very good.
Do you feel like you were already kind of doing your own telehealth, except not personally all these years?
Do I think? Oh, that's interesting. No, I really always thought I was doing psychoeducation, and I had a model in my head. Well, originally I was 24 years old when I started this stuff, and it was just, what would I have needed? Pre-internet, pre-everything. Stuff is hard, easy to understand if somebody explains it, but no one was explaining it to young people, and it was really HIV. Well, it was AIDS. We had just stopped calling it grids, and we're just starting to call it AIDS. And I was treating tons of these patients, and it was, that was a pandemic with a 100% fatality rate, 100%. And it was awful like you can't believe. And no one was talking to young people about how to protect themselves. I thought that was insane. And I had one Anthony Fauci out there at the time, who was somebody I thought a lot of, telling us younger physicians to get out there and educate, get in, do the media, do everything you can. Or he kept saying there's going to be 2 million dead, 2 million dead. I remember that. And we ended up with 225,000, 175,000, and we congratulated ourselves that it wasn't 2 million dead. But it was really medical that put me out there. But I fell headlong, by being out there and answering questions, into mental health. Because when you're creating a medical show for adolescents and young adult, it's not it's not lung cancer, colon cancer, and schistosomiasis. It's relationships, accidents, substances, reproductive health. That's their medical health. And you very quickly get into their interpersonal health as well, which is where all of our stuff plays out in terms of whatever mental health proclivities we have.
Mm-hmm. And so then after, what got you into the addiction part of it too?
So that's a longer story. I was going to be a cardiologist. I was very good at critical care medicine, and I started moonlighting at a psychiatric hospital in 1985, I think it was. And I got very interested. I always kind of was interested in it because of my own stuff back in college, and I just was interested in it. And thought, this would be fantastic. And I got very good at the medical care of psychiatric patients. I learned a ton about psychiatry as a result. And I just kept going down that road. I ended up taking while I was doing general medicine, on one hand, I took over the medical services in the psychiatric hospital. And eventually, a lot of the medical problems were down on the drug unit. I got very good at drug withdrawal because I knew nothing about addiction. This is now 1986 or something. But I liked the environment. I liked the patients. I liked that I could get them off the drugs relatively comfortably. And this was this at a time I was working at a county hospital, and nobody had made a discipline out of treating drug addicts and treating their withdrawal. It was very haphazard. But I came along at that time, and there was a physician running the addiction program at the time who'd made it a clinical discipline. The American Society of Addiction Medicine was just sort of forming. And I thought, wow, I should really know how to do this. I see so many of these patients in my training and all. Should be, good at this and understand it. So I got good at it. And then was spending a lot more time down in the drug unit. And the longer I spent down there, I kept looking in through the window at the treatment room, thinking, what is that screwy stuff they're doing in there? What are those 12 steps on the wall? What is that nonsense? I'm doing the work here. I'm getting them well and getting them off drugs. And I saw some people recover. I saw some people in a relatively short period of time, young people, go from dying to amazing. And you don't get to do that in medicine very often. Usually you go from dying to chronically ill. And this was amazing to me. And I thought, I got to understand this. And so I got more into it. then in about 1990, 91, because I was down there all the time, the director of the program asked me to be his assistant director. And his call was, again, comical. He's like, oh, no big deal. I just, I need some help. And it's really, I need coverage during the holidays. And you're down there all the time anyway. It won't be a big deal. 6 months later, he quit. And that moved me into the position of director. And so I really had to get my act together, which I did. And it became a major focus from then on.
Well, yeah, it's National Alcohol Awareness Month. Mm-hmm. And I have so many people that I know now, even I don't drink. I stopped drinking 3.5 years ago.
Congratulations.
Thank you. Yeah, it was, I will take that congratulations, as it does feel really good. Mm-hmm. But yeah, I have so many, friends and people that I know that are struggling and that are trying even to just get off, they want to stop drinking for a few months. And it seems like what I keep hearing is because of COVID, we started drinking more. During lockdown. And so now they just can't get out of it. Have you been hearing more about that? And
yeah. People got into trouble that previously were not in trouble.
Right.
So, and now they're in trouble, and now it's time. It's alcohol treatment is a interesting topic, right? The thing. I just happened to have been exposed to some amazing recoveries over the weekend. I just love being a part of that when people turn to these new people and are just so thrilling to be around, and all the miracle of recovery is in their life all the time. But not everyone has to do that. And that actually makes me kind of sad sometimes when people are struggling and just trying to do it their own way. It's like, okay, it's okay. I mean, if you haven't thrown the switch, so to speak, yet on your disease, if you haven't lost control, you might be able to control it, and good for you. You're missing out on a lot of personal growth so long as you maintain a relationship with that substance. But okay, I mean, everyone's got to figure out their own path. But it's an interesting topic, and the other thing is people don't know just some basic information about recovery and alcoholism. Professor John Kelly at Harvard, the head of the addiction program there, has some data that shows. I hope I'm quote. It's either 5 treatments in 4 years or 4 treatment in 5 years. I think it's 4 treatment in 5 years on average in order to achieve 1 year of sobriety. So this idea that people have, they're just going to go get treatment and be done with this, no, doesn't work like that. It takes multiple treatments, and each one moves people closer to really running up the flag, as we say, really surrendering to what they need to do. However, the other correlate with that is the longer you spend in treatment the first time, the better the outcomes. More treatment, better outcome. More structure, better outcome. More time, better outcomes.